This is Michelle from Physioactive Indonesia, bringing to you our Malaysia Surgeon Insight series. Today, joining us is Dr. Ong Shong Meng, Consultant Paediatric Orthopaedic Surgeon from Sunway Medical Centre, Malaysia. How are you, Doctor?
I'm good, Michelle. Thank you for inviting me.
Thank you for taking the time to give us some information here. So, Doctor, let's start with a brief introduction. Can you tell us about your qualifications and experiences?
I'm Dr. Ong Shong Meng. Uh, I graduated a while back in 1993 from Glasgow University. Did my postgraduate training in the UK, mainly in Glasgow, Leicester, Nottingham, and Newcastle. So I did my subspecialty training in Sheffield Children's Hospital, and I was a consultant there for almost 7 to 8 years before I came back to Malaysia. And I also was awarded Doctorate of Medicine back in 2001 for one of my theses on hip joint replacement. Currently, I'm practicing as a orthopedics and pediatric orthopedic surgeons in Sunway Medical Centre.
So, today we will be addressing guided growth in pediatrics. Guided growth in pediatrics refers to a medical procedure used to correct growth abnormalities, particularly in children with conditions that affect the growth and alignment of bones. Doctor, please explain to us in more detail about the concept of guided growth.
Okay, the concept for guided growth is we don't actually affect the growth. The growth is actually comes naturally from a growing child. So this procedure can only be applied to children who are still growing. Essentially, the growth plates are still open. Now, what is guided growth? Essentially, is to try to use the power of growth to guide the direction of the bones where it's actually growing. For example, when you have certain deformity in certain direction, if I make the bone grow in one direction more than the other, hence that will correct the deformity. So how do we do that? We do that by applying a plate and a screws onto one side of the growth plates where you do not want it to grow too quickly. You allow the other side to grow a bit quicker. That is how it will drive the correction of the deformity.
Okay, and how do you ensure a patient is the right candidate for this medical procedure?
Okay, first of all, we need to make sure that the child required the surgery. Essentially, he or she has got a deformity that is, from a risk and benefits point of view, is worth correcting. As you know, none of us are born with a perfectly straight legs. So, as from a biology point of view, we are allowed to have certain amount of so-called bend in your legs or in your knees. If let's say you are outside that normal range where it's going to affect the function of your walking or even the function of joints in the future, that will be the correct candidates for correction of the deformity. So we do that with a number of ways. First of all, clinical examination. Secondly, will be an X-ray looking at the alignment of the legs, where we will make various measurements to make sure the angle of those bones are so-called abnormal. If this falls into those categories and the child growth plates are still open, that will be the right candidates to have this procedure.
And what would the surgery entail in the sense that can we have a feel of the process and the post op care, the downtime, and all the details?
The operation entail, of course, this has to be done under general anesthetic, and we have to make sure that the patient is fit to undergo general anesthetic. And what involved, depending on the direction of deformity, we will do a pre-planning to see where should we be putting the plates, whether on the inner side or outer side of that bone, or we call them medially or laterally. And you need to make sure it's the right growth plates. And before we even embark on the surgery, we have to make sure that the growth plates is still open. So, for example, if let's say the growth plates are already closed, this means there's no potential of any growth for the child, then this procedure will not be suitable. So once you've determined all this, the operation entail making an incision on the site where you're going to put the plates. Normally is around 3 centimeters in length. Uh, and we normally just lay the plates onto the surface of the bone, and then through an X-ray guided procedure where we actually put 2 screws, one on top of the groove plates and one below. And that's the end of procedure. So normally the procedure itself to insert a plate will take around 25 to 30 minutes. And about downtime. So the wound will take around 2 weeks for it to heal. Normally, the patients were required to walk with a walking aid in the first 2 weeks. And I would expect on average, the child will go back to do their normal activities, for example, like sporting activities, 4 to 6 weeks after the procedure.
So, just to clarify, for patients that want to come from Indonesia, in terms of their travel itinerary, how many days do they need to allocate to be there at the hospital or in Malaysia?
So in my experience, normally all they need to stay in the hospital for around between 3 to 4 days. And at that time, they should be able to go home. But of course, there will be some discomfort when they walk. Normally, they will require a pair of crutches to get around. By the time 2 weeks down the line, most kids would have discarded those crutches.
And would you like to share with us some patient cases for more clarity?
So this is case one. Is a 14-year-old male. As you can see from X-ray, he has what we call genu valgum. Essentially, he has got that legs that's shaped like an X shape. And he came to us with a bit of pain in the knee joint. So after all the initial assessment, he's suitable for this type of guided growth surgery. So the next slide, what you can see is the slides of the X-ray taken during surgery, where you can see a plate is being placed onto the surface of the bone, and the 2 screws are inserted. So one can see that the plate has been applied to both the femur and the tibia bone. Because this boy is 14 years old, he probably have another 2 more years of growth. That's the reason why we're doing both bones to hasten the deformity correction. And this is the follow-up X-rays. One can see that it gradually, from the X shape, they become straighter. Once we achieve the correction that we want, then we'll get the patient in to have the plates removed. Now, this is very important because if, let's say, we do not remove those plates and left it in, the deformity may go the other way around. Yeah, so for patients from Indonesia, it is very important that after the surgery, they are being followed up every 4 months. So they have to come to my clinic where an X-ray has to be taken to look at the correction. A second case is a 9 years old boy who has a diagnosis of Blount's disease. Essentially, you can look on the left leg, the tibia bone, which is a lot, you can see it's actually bending inwards, making it like a O shape. So this boy was walking, essentially limping because of one leg is straight, the other side is bent. So we embark on the 8 plate. So the next slide that you can see is the X-ray that are taken during the surgery, where we were inserting the screws. One can see this is the follow-up X-ray after a period of around, I think around a year. And you can see how the legs actually slowly correcting itself. Once the corrections are full, which is the X-rays before you, that was the time where we removed the plate. Just to give you an example, this is not guided growth. This essentially is a case where this is now an adult, no longer a kid. She was in her 30s when she came to see me. So she had a bendy legs, which people call them O shape. And she also developed early osteoarthritis of the knee joint, which causes pain. So for this reason, because she has finished her growth, we no longer can use the 8-plate guided growth. So we use another method to correct the deformity by doing an osteotomy, essentially breaking the bones and trying to realign the bone. In her case, I did something extra on top of that because she's very keen to be a few centimeters taller. So that's the reason why I use a special frame to give her the height that she wants.
This is great information, Doctor. Thank you so much for your time. For our viewers, if you are interested in speaking with Dr. Ong, you can have a look at his contact details in the description below. If you are planning to get your surgery in Malaysia and live in Jakarta, you can start your physiotherapy in Malaysia and continue your rehabilitation program in Physioactive Indonesia. On behalf of our entire team at Physioactive Indonesia, we want to thank you for tuning in, and we look forward to bringing you more top quality content from leading industry surgeons. Thank you, Doctor.
Thank you very much.